Welcome to a social media live by the WHO and welcome to World Diabetes Day. Our topic today, as you guessed it, is diabetes. My name is Walter Owens. I'm a social media officer at the WHO in Geneva, and I am joined by three guests. First, let me introduce Carmila Munadi, who's joining us from Jakarta, Indonesia. Camila is a diabetes advocate that has been diagnosed with type 2 diabetes in 2010. Welcome, Camila.
Hello, everyone. Nice to meet you guys.
Thank you so much for joining us today. The second guest that I would like to introduce is Sally Hendricks, who lives with type 1 diabetes and lower limb amputation. Sally is a public speaker based in Cape Town, South Africa, and he is an advocate for diabetes. Welcome, Sally.
Hi, good morning, everybody.
And last but not least is WHO's Dr. Bente Mikkelsen, who's the Director of Non-Communicable Diseases at the WHO headquarters in Geneva. Thank you for joining us today, Bente.
Very pleased to be here.
Great. Thank you all for joining today. And for those who know, you can ask questions. You can simply put your questions on diabetes in the comment section if you're following us on Facebook or LinkedIn, or if you are on Twitter, just use the hashtag AskWHO, and we will make sure that our guests will answer some of your questions. But let's start with you, Benke. Would you like to explain to us what diabetes actually is?
Yeah, thank you, Walter. And so happy to be on this Twitter chat with all of you, and happy World Diabetes Day. It's very important that we celebrate the World Diabetes Day. And the reason is that since 2014 or around 2014, we know that 422 million people are estimated to live with diabetes. And this is a very rapid development, because if you look at 1980, we had around 108 million, and we know that this is unfortunately on the rise. So when we are speaking today, we are really speaking about something that is affecting so many people. And what is especially very concerning is that if you look at non-communicable diseases in total, diabetes is the only one that is still on the rise when it comes to killing people before the age of 70. So cardiovascular diseases, cancer, and chronic respiratory diseases is sort of improving, while diabetes is unfortunately on the rise. And I would like to add one more thing, because still I think the information or the awareness of diabetes is not as high as we wish it to be. So I think people know about type 1 diabetes, but what is really the most frequent form of diabetes is type 2. So type 1 is not preventable. We don't really know why we get type 1, while type 2 is often preventable through healthy diet, regular physical activity, and also to, maintaining healthy body weight and avoiding tobacco use. I go back to you, Walter, because I could speak forever, but that's not the point here, right? Walter?
Sorry about that. I would like to ask Sally, who's living with type 1 diabetes, if you could explain to our viewers what are some of the complications that can occur.
Yeah, Walter and the guests, the complications that actually arise from diabetes. I mean, I was diagnosed with type 1 diabetes at the age of 17. And at 22, I started with some of the complications with the retina, where my veins actually burst at the back of my eyes. In fact, both eyes at the same time. And I developed kidney disease during the period between the age of 20 and 25. From 25 onwards, after my neuropathy, my veins bursting, I had laser op and everything, but you go into a stage of denial. And this is actually something that is very important. Being a diabetic, don't go into denial, because the complications actually creeps up slowly but surely. And looking after myself for 20 odd years, but getting to the age of 49, 50, and I suffered or still suffering from peripheral arterial disease, and it made my walking very, very difficult. And getting an infection in my right leg, they couldn't save my leg because of the peripheral arterial disease complications that I had. And yes, I had to actually have an amputation. But having most of the, you can say, complications, hypertension, kidney disease, neuropathy, peripheral arterial disease, it is something that, with more awareness, it is something that we have to actually take care of ourselves. So complications will creep up. I've been looking after myself for all these years, but yeah, and still going, after 41 years of being a type 1 diabetic.
Thank you, Sally. And you mentioned that complications, I guess it was like a process. Could you tell our viewers what it's been like after the diagnosis, and how living with diabetes has maybe also affected you since then?
Yeah. I think the main thing is actually coping with the change. And coping with the change over the years is, for example, you're a teenager and, you're living in Cape Town, South Africa in the 80s, and you don't actually have the technology to test your sugar, and your sugars are only tested once a month when going to hospital. And I'm not blaming any system, any governments or anything, but if technology was actually available at that time, but I know that the CGMs and the glucose monitors to the public wasn't actually accessible here in South Africa. The hospitals, of course, they were the only ones that actually had the glucose testing machines. And as the years went by, technology was actually introduced, but living again in South Africa, Cape Town, getting those technologies, and you're under the public sector, you don't actually get exposed that quickly to technology. So yes, coping with change is something that was something hard for me. But today, if I actually look at everything that has been developed with technology, the new medicines and everything, it's actually beautiful to see the progress and the caring for the systems for diabetes around the world. And the only thing is that saddens me is that these technologies are not accessible yet, or is accessible but not freely accessible to the third world countries.
Yes, and I just want to have one question from one of our viewers, because you've been talking about type 1 diabetes. On Facebook, Khan Jahan is asking, can type 1 diabetes be reversed?
No. For me, looking at every research papers and and actually working closely with doctors here in South Africa, with the South African Non-Communicable Disease Alliance. For me, if my pancreas or my organ has stopped working, maybe in the future, I don't know. But at this moment, I don't see that there is, the promises that's been made out there that, a cure will be. But for me, I'm at peace with my diabetes, and I just have to take care of myself. That's all. And with the insulins and the technologies like my glucose monitors and CGMs, I'll take the best care of myself.
And Camilla, I mentioned at the beginning that you've been diagnosed with type 2 diabetes in 2010. Could you tell our viewers how that has affected your life?
Okay, so it's been up and down for me because at that time when I was diagnosed, it was actually on my way on a recruitment process. So I was trying to get a job at that time, and at that time I just found out from the medical checkup result that my blood glucose level is high. So yes, at that time it was like suddenly it was like dark because I feel like I have no future. But then I found a new family, a community, diabetes community, which helped me to get back up. And life must go on. I still have a long way to go. Therefore, I encourage myself to get up and be positive, and then trying to accept the condition that I have. Just sort of like that.
Yes, I'm sure it takes a lot of strength also to go through it. Bente, you mentioned at the beginning that diabetes is on the rise. We have a question from Twitter where Francis Idris is asking, why is it the case that diabetes is on the rise?
So there are many reasons, but it's the way we live. We see that we have a different lifestyle, less physical activity. We see that obesity is increasing, and we also see environmental factors. We don't fully understand the picture yet. So one of the main things is, lack of physical activity, shift in how we eat. That is very important. So that's also why I wanted to sort of, to the first question about is type 1 possible to reverse? No, it's not. But I want to emphasize that all diabetes is treatable. So I think, my colleagues online here show this. I mean, your long story showed that because you took care of yourself, as you said, within the conditions, within the possibilities of South Africa, you managed to have a good life and to keep that under control. And when it comes to type 1, I think it's very important that we have to understand that insulin in that case is a life-saving commodity. So that's also why, access to medicine, to insulin is so important and have been also part of what WHO have tried to achieve through the Global Diabetes Compact. So I think, that it's the way we live that we need to address. It's also, of course, the way that our environment is acting. So we know that it's only so much we can do ourselves. We need the protection from government. We need to address the commercial determinants of health, which actually wants us to have more sugar, more fat, and influence us in a very bad way. So the way to cope with all of this is, first of all, of course, the awareness raising, to be able to train people to understand how they can help themselves. But it's also to put, the commitments on the government to try to reduce the pressure of the single person on all the negative influence. and also to work, to influence from our end through regulations, the private sector, but also in the positive way to influence and get commitments from the private sector to lower the prices and make, glucose meters, insulin, the sticks and everything available for patients. So there is hope, there is a lot of opportunities, it's inequities, but still this is what we are trying to address.
Yes, and inequity is always a very, very big problem, especially for this topic. But I want to follow up on one thing that you mentioned. You mentioned insulin. Could you explain what insulin is and why it is so important to have access to insulin?
So it is especially important for type 1 diabetes. So type 1 patients with type 1 diabetes will actually die if they don't get insulin. And it's not only just to get it once in a while, it has to be a regular supply. So this is a life-saving commodities. So what we see now in the humanitarian crisis around the world, we see people dying because of the stop of insulin. So I want to really underscore this because we know that there are certain things that is life-saving. So we are not able to utilize sugar if we don't have insulin. So this is very, very important. So, it should be on the list that was absolutely basic for any country everywhere in the world. And this is also what Professor Banting 103 years ago said when he discovered insulin. This should be free for the world. So that is really a basis. What is less known is that insulin is also very much needed for type 2 diabetes patients, not all of them, but we know that there is a huge need. So we say that approximately only 50% of those who are in need of insulin at the moment are able to access insulin 103 years after this huge innovation. So this is also why we are working so hard to try to get the commitments from the producers of human insulin. And we have managed that to some extent. So there are good news. We want to have local production. It's happening now in Egypt and in South Africa. And I see that there are sort of light in the tunnel, and we address it very heavily in the humanitarian crisis and through, situations like the pandemic when the health system actually broke down for chronic diseases like diabetes.
Okay, thank you. And I have a question. Actually, it's a reoccurring question that we get quite a lot on social media right now. We mentioned that type 1 diabetes is not reversible, at least up until now. What about type 2? A lot of people are asking that question.
So I cannot give you exact figures, but we know that with sufficient attention to all the risk factors, it is possible to keep it either at a very low level, so we avoid use of insulin, but also there are reports that we can delay or even sort of reverse, but we don't know to what extent. But we know that all the risk factors, if we address them, we will be able to maintain a very good situation, even for people that are diagnosed with type 2. So I cannot tell you exactly the impact of each of the modifiable risk factors, but we can safely say that if we pay attention to try to eat healthy food, have physical activity, avoid tobacco, alcohol, we will already be in a very good place.
Okay, thank you. And Sally, I want to get back to your story, your life story, that you were talking about, your complications. Maybe now in hindsight, and Bente also touched upon this a little bit, the importance of access. What would you like to have seen back then? What kind of health systems support would have helped you maybe to cope better with your type 1 diabetes?
Yeah, for me is actually education. That would actually be something that it shouldn't be hidden away from us. It should actually be out there. if a healthcare provider comes to us and say, eat healthy, do exercises, but if they must understand the socioeconomics behind a third world country, and because for me, if somebody says eat healthy, do they know what I can actually afford? So this is topics that or I will steer away from the word or words eat healthy. I would actually say eat what you can afford to sustain yourself, because I work with groups of children, type ones, that they don't have a meal in the morning, but they actually inject themselves. So it is something that you actually feel saddened, on just the way things are, or your socioeconomics, or your environment. So it depends on your environment on how to actually look after yourself, what your country state of the health status is, or the policies are, but just to actually live healthy is actually a struggle all over. And it's not to condemn anybody, or the wording or the terminology, being used on all our platforms, but more with the empathetic way of, if I approach a person in Uganda, or Ethiopia, or wherever up Africa, I actually steer away from all the terminology that they will take offensive in their health systems.
And you mentioned 2 points that I would like to follow up on. One is the aspect of education, but first of all, I want to talk about terminology, because you just mentioned it. Can you give an example of what is the right terminology to use, or how to use inclusive language for somebody with diabetes?
Yeah, sometimes, we've been all part of the, stigma, the diabetes stigma on, you are, lazy, you stay sick. And, these are all the terminologies, because I've experienced it, where, somebody invites you out to something, and today you can, I'm okay today. But when I switch off this computer, or if I'm finished with this live Q&A, I could go sick, or my sugars could go up, and I wouldn't feel well. So it is terminology like you stay sick. Why are you constantly moody, So you can't control those things. And so mood swings, calling out names, it is something that actually hurts us. And to be more, to actually be more empathetic to people with this type of immune system diseases, or any immune disease, or any disease, in fact. And being a diabetic amputee, it was something that I became conscious on body image as well now. So it's not just, you are lazy, or you're tired, or this. How will people accept me as a half a man, or three-quarter man? So it plays on you, and you become emotional, and that actually plays on your mental health again.
Yeah. And you mentioned stigma, and both you and Camilla are passionate advocates for the cause of diabetics. How can we reduce stigma? What can we do, actually?
It's like when I was in primary school. In fact, I was at 2 lower grade schools, and no matter where you go, you will always find the bully. And it is just on how people were actually raised on accepting people or a human being, be it its color or be it his appearance or anything. And these are the things that should be, like, I mean, if we have the education for diabetes, it is something that will be brought up on how the bully was actually brought up. So if he takes it into his personal life, into his social life, and if he actually sees people that are not the same as he is and want to oppress you, so these are all the things that that actually arises via the stigma. There's lots of
Yes.
things.
And Camilla, I want to draw you a little bit in the discussion. What's your experience been, and how do you advocate for less stigma and more inclusive language?
Okay, so if I talk to somebody else that I said I have diabetes, they would say like, "Oh, you should decrease your sugar consumption, etc., etc., like that." And they would like think that I think that's because is that because you really love sweet things, or is it because you're too fat or something like that? And it's actually hurts because nobody wants to be sick and nobody wants to have this kind of condition. Also, if it's only diabetes, even when you get diabetes, it's not just because you have take too many sugar, because it's more complicated than it is. If you say that because maybe because you're overweight or obese, yes, obesity is one of the factor of diabetes. But if only we are talking about obesity, then there are a lot of people whose the weight heavier than me, and they maybe eat a lot than me, but their threshold is higher than me. That means they don't have diabetes while I have. And that's the fact that I need to accept too. But yes, to be told that because I'm greedy, I eat a lot, that's kind of hurt. And that's the stigma that I have to face also. And, but I think that's because people don't know yet what is diabetes and how to deal with people who live with it, because they might not know how it feels to be in my in my place. So I think education is very important to decrease the stigma. So other people who don't have diabetes have a better understanding towards people who have one. You don't need to judge. You just need to be there and help if they need it, but just no judge. That will be, it's the most simple thing that I would very appreciate it. Just don't judge like that. Just try to, if you don't understand and you cannot understand and you just simply don't want to accept people with diabetes, then just don't comment anything. That will be better than saying words that you think it's okay, but it's actually not. For example, maybe other people, or maybe people with diabetes itself in the older way, like to say it themselves as sugar factory, like that. It's actually not a good terms, and yes, that's a very negative thing. So because actually we're not a sugar factory, and we don't want to be like that, right? And we're trying to decrease or to keep our blood sugar as normal as we could. Also, there's a term in Indonesia that we would like to change is suffer. Um, as diabetic, we have to live with diabetes for the rest of our lives. Okay, type 2 can be reversed, but with a very tight discipline and everything. If you don't have any complication, yes, you might still, maybe that will be easier. But for people who already have complication, that will be more complicated too for them to keep their blood sugar in check. So, but when people label you as a sufferer, it's make ask like, oh, okay, so do I really suffer like that? So I prefer the terms people living with diabetes or people with diabetes, or in Indonesia is penyandang. That's more let's say neutral, like that.
Okay. And I guess every person living with diabetes has a different experience. So who are we as outsiders to judge them? Bente, maybe on the WHO perspective,
Yeah.
what is WHO doing about
No,
diabetes?
I think this is a very important discussion, and I would first of all like to really warmly congratulate both Camilla and Saleh to be here with us and telling their story. And when we launched the Global Diabetes Compact in 2021, we were strongly convinced that what we need to change was the conversation. So early on, we invited people with lived experience on diabetes in. They helped us to shape the program, and they were very strict with us. So, they told us, for example, that there is a huge stigma out there. So one of the first things we did was to do a stigma survey. And it is quite amazing because of course, the discussion about healthy diet, Saleh, is difficult because I need to talk about healthy diet at the same time as a healthcare professional and a public health expert. But at the same time, I fully understand what you're saying. You're raising two things. First of all, it's not a blame on any single person. It cannot be, because you live in an environment, and unfortunately, in very many places, the healthy food is the most expensive one. So of course, it's not your choice. You have to make choices, which is super difficult many places. You have a family to feed, you have a life to live. You cannot just choose the most expensive if it's available at all. So it's very tricky, and I don't think it's a one fix. I think we need to put this on the table all the time. So that's why in the Global Diabetes Compact, we have a Global Diabetes Compact Forum, and we have made it a very important commitment that we need to work with the people with lived experience. We work with civil society, we work with UN agencies, with academia, with philanthropies, with private sector, but we need to co-create the solutions with the people with lived experience. And one of the first things when we launched the 6 work streams of the compact that was added because of the people with lived experience was exactly education, health literacy, health promotion. So they were very clear with us, okay, access to insulin and glucose meters and sticks is very important. Strengthening the health system needs to happen. But unless we have educated people with lived experience, but also, those who are actually going to respond, not only within the health sector, but also in all sort of different situations along the life course, the kindergartens, the schools, even the nursery homes for elderly. People need to understand. So I'm extremely happy that we made this choice, and actually it turned into be the pilot. So what we have done on diabetes, we now try to replicate on many other disease areas. And we have also a framework for working with people with lived experience developed in the organization to help also governments at different levels to do the same. So I think this is extremely, extremely important. And I also want to mention one thing, because none of you have mentioned that so far. People living with diabetes also tend to have a higher risk on many other diseases. This is another area that is, very much unaddressed. So just as we speak, you will see that my colleague, Dr. Teresa Kazeva, is tweeting, because we are also working very closely with them to address the higher risk of diabetes with people living with tuberculosis. And this is also important. So we need to not only look at person living with diabetes as a person with diabetes. It is a person, and it's a person with certain increased risk, and it's a person that will also experience the same thing and at same risk as many other persons. So this is important. I just want to bring us back 2 seconds, Walter, to the topic of the day, namely on complications. And I think it's the first time, Sally, that I'm together with somebody that talk about being amputated. This is something we discuss, and when you talk about stigma, I think we have an, even more, I would say, risky situation when it's visible as well. So I'm very happy that we use this day, this World Diabetes Day, to focus on the complications. Because unfortunately, it is many misconceptions about diabetes. So one is it's fixable, it's just give them insulin, everything is good. So people don't understand type 1, type 2, all the things that can. But then when we start to talk about the complications, this is very much an unknown. Unfortunately also, among people with lived experience. So they don't check their eyes, they don't test their kidneys, they don't, react as you talked about as well, what happened to your limb, and they are not informed either by people. So I'm very grateful that we had this chance also to highlight this today. Thank you very much.
Thank you, Bente. And just one quick follow-up, because I think it's important, and a couple of people have asked it on our social media channels. How do you actually know that you have diabetes? Is there a test? You mentioned a couple of points. Maybe you can just explain it one more time so that people are aware outside on social media.
So
I think you're muted. Sorry.
Muted. Sorry. So it's not always easy to know that you have diabetes. I'm sure that Camilla and Sally can talk a lot about this. So there is a need for an awareness in the health system as such, from kindergarten, as I said, actually from the pregnancy and through the whole life course, because type 1 comes, of course, early age, but type 2 can come in any age, actually. So there is a need to understand. So many of the symptoms are very vague. It can be, as you were talking about, Sally, mood changes. People can be aggressive. They can be depressed. They can have fatigue. They can feel dizzy. They can, collapse. There are many, many, many different reasons. Some people are actually diagnosed because there are changes with their eyes. Some are diagnosed because of the kidney changes. So maybe they actually introduce themselves with their complication. But to find out if we have diabetes is very simple. So it's actually a blood test that will help, and a urine test. So it's not a difficult way to actually get the diagnosis, but it can be very difficult because the symptoms are vague. So I think if you are on a regular check at your doctors, it's important that maybe yourself can raise it or talk about it. It's also important if there are people in your family that already have diabetes, then you know that you are probably at a higher risk and so on. So again, it's about public in education. It's about, inspiring advocates like we have today. People talk about it. But it's also, of course, health literacy, that we need to educate those at risk or to try to reduce the risk factors in general.
And diabetes really is a tremendously important and also fascinating topic. And I'm sure we could continue talking for another hour or so, but I'm aware of the time. So I wanted to ask a question to Camilla. If we were to have this chat again in, let's say, 5 years' time, what would you hope has changed? What are your expectations?
I expect that we will not discuss about stigma again, which I assume that there will be no more stigma, especially the negative, of course, towards diabetes or people with diabetes. And I would love that we would have to talk about technology of diabetes and things that could help people with diabetes to maintain their condition and stay away from the complication of diabetes.
Thank you. And maybe the same question to Sally. What are your expectations?
My expectations, I mean, interesting enough that you're asking this question. I just did a little thing on the history of diabetes, and just looking 3,500 years back with the honeybee disease, that diabetes was named then. And coming to 2023 and looking at another 5 years to the future, for me, I would love to see every person with diabetes, type 1 or type 2, with the proper medication, proper diagnosis, just for them to have, if the technology is developed, as for every diabetic to have it, not a class distinction in you in a poorer country, I'm in a richer country, I can afford it. It's for every diabetic, no matter where you are in this world, is to have the same care and same technology.
Thank you so much, Sally and Camilla. I think these are really, really hopeful aspirations. And maybe Bente, do you have a last closing sentence, something very short?
I'll try to be short, and I don't want to stop because I think we should continue the conversation, but I hope that the vision for the Global Diabetes Compact comes true, and actually Sally has already said it, and with an emphasis also on reduction in the risk factors. We can do that. It's possible. It's all the best buys of the NCD Global Action Plan is there for governments to use. And then I hope that all hands are coming on deck. So we need everyone to stop this development and to really live the vision. So please, all that is listening online, try to find a way to engage yourself with the Global Diabetes Compact. It's easy to find. I will tweet about it later today. Please come and support. We can make it together.
Thank you so much. For all of you who are interested in diabetes or in the World Diabetes Day, please visit our website, who.int. You will see the link on the homepage, or you can go on a health topic page and you scroll down to diabetes. A big thank you to Camilla, Sally, and Bente for joining us today. It was really, really nice. And I hope to see all the viewers again next time. Thank you so much.
And thank you, Walter.
Bye-bye.
Thank you all.
Okay. Thank you. Thank you, everybody. Bye.